today in this video I want to discuss about the thoracic vertebrae. Okay, now we all know we have total 12 thoracic vertebrae. Okay, and out of the 12 only T2 to T8 are the typical thoracic vertebrae. Okay, that means remaining five thoracic vertebrae are the atypical thoracic vertebrae, like the T1, right, and T9, T10, T11, T2, right. Okay, these five thoracic vertebrae are atypical thoracic vertebrae. Okay, now we come to the thoracic vertebrae. Okay, in this video I only discuss about the attachments and general features and the type of joint and the joint that are formed by these vertebrae. Okay, that are formed by these thoracic vertebrae. Okay, now you can see now this is thoracic vertebrae. Okay, how now this is the irregular bone, right? Why it is irregular bone? Because this is thoracic vertebrae. Okay, thoracic vertebra are irregular bone. All the vertebra are irregular bone, right? Why they are irregular bone? Because this bone don't fit into the other category of the bone, such as the flat bone, right, long bone, short bone, right, or sesamoid bone, right. Okay, they don't fit into the other category of the bone, right. That's why we call them as a irregular bone, right. Okay, ठीक है ना. And this irregular bone protect the spinal cord and internal organ of the body, right. You know all these things, right. Okay, and this irregular bone are composed of the calcaneus tissue, right. Calcaneus tissue and the outer thin layer of the compact bone, right. Okay, so this is which type of bone? This is irregular bone, right. Okay, now we come to the general feature of this thoracic vertebrae. Okay, now you can see, right, now you can see the thoracic vertebrae. Okay, first of all, how we identify the thoracic vertebrae? Okay, we can identify the thoracic vertebrae, okay, by the presence of the rib passage, right. Okay, if you find the rib passage, then you must say this is thoracic vertebrae. Okay, now the thoracic vertebra are consist of two parts. You can see this is the body, right. Okay, this is body, right. Okay, and this is the vertebral arch. You can see this arch is known as what? The vertebral arch. Okay, now body is heart, right. This body is heart, right. Okay, now in the body you can see this is the anterior surface, okay, and the posterior surface, right. This is the posterior surface. Okay, so we can find the posterior surface by the presence of, you can see, the multiple foramen. If you check your posterior surface, you can find the multiple foramen, right. Okay, and that foramen will provide passage for the basic vertebral vein, right. Okay, and what are the importance of basic vertebral vein? The basic vertebral veins, right, it spreads the infection from the pelvic from the pelvic region to the spine, right, from the pelvic to the spine, right. Okay, this is the importance of this basic vertebral vein, right. Okay, now we come to the vertebral arch, okay. In the vertebral arch, okay, vertebral arch composed of what? Vertebral arch is composed of the you can see the pedicel, right? Pedicels, lamina, right, and the seven process, right. Okay, so these two are the what? These two are superior articular process, right, and these two are the what? Inferior articular process, right. Okay, and these two are the transverse process, and this is the what? This is one of the spinous process, right. Okay, so total seven processes are here. Seven processes are here, right. Okay, seven process present in the vertebral arch, right. Okay, now we come to the attachment, right. Okay, in the attachments you can see in the upper border, right, in the upper border right, in the upper border of the body, it will provide attachment to the anterior longitudinal ligament, right. Okay, and in the posterior aspect, the lower border, right, lower border of the posterior aspect, it will provide attachment to the posterior longitudinal ligament, right. Okay, now the two ligaments are attached in the body, right. Okay, now we come to the attachments in the transverse process, right. Okay, so the four ligament, right, four ligament and one muscles are attached on this transverse process, right. Okay, so what are the fourth ligament? The costotransverse ligament, right. Okay, so costotransverse ligament means the transverse process, the ligament which is attached between the transverse process and the ribs, right. Okay, that's why the names are costotransverse ligament, right. Okay, so the costotransverse ligament, like three costotransverse ligament, the superior costotransverse ligament, right, lateral costotransverse ligament, and the inferior costotransverse ligament, and the fourth ligament, that is what? The intertransverse ligament, right. Okay, now we come to the attachment of the lateral costotransverse ligament, right. Okay, so lateral costotransverse ligaments are attached, right, attached at the tip, right, at the tip of the transverse process, right. Okay, and the superior costotransverse ligaments are attached at the lower border, right, lower border of the transverse process, right. Okay, and the inferior, right, and the inferior costostomach ligaments are attached at the anterior surface of the transverse process. Okay, so in the you can see the one ligament, right, one ligament that must be present in between the one ligament that connect these two transverse process, right, okay, and this ligament is known as for the intertransverse ligament, right, okay, and this intertransverse ligament that must be present in the lower border, right, lower border of the one vertebra and the upper border of another vertebra, right, okay, and this ligament is known as what the intertransverse ligament, right, okay. So intertransverse ligament presence in the lower border and the upper border of the transverse process, right, okay. In the lamina, right, okay, in the lamina, right, the upper border and the lower part of the anterior surface, right, lower part of the anterior surface, it will provide attachment to the ligamentum flabber, right, okay, ठीक है ना. Now we come to attachment in the spinous process, right, okay. So in the spinous process, you know, the tip of the spinous process, it will provide attachment to the supraspinous and infraspinous ligament, right, okay, ठीक है ना. And all the muscle, right, all the muscles are attached in the all the back muscle attached in the spinous process, right, okay. You know, the levator scapular muscle, right, trapezius muscle, right, and the serratus posterior, so serratus posterior superior muscles, serratus posterior inferior muscle, right, okay. All the muscles are attached in the spinous process, right, okay. In this way, you can see in this way, right, all the muscles are attached in this way, right, okay, ठीक है ना. And all the back muscle, right, okay, or whatever, you know, the trapezius muscle, rhomboideus muscle, levator scapular muscle, serratus posterior muscle, you know, right, you know all the muscle, right, okay. Now we come to the another muscle, right, another muscle also attached in the posterior surface of the transverse process. It also provide attachments of one muscle, you know, the levator, right, levator costal muscle attached in the posterior surface, right, at the posterior surface of the on the posterior surface of the transverse process, right, okay, ठीक है ना. Now I have completed the attachment, right, at all the attachment, right, okay. Now we come to the joint, right, joint formed by this vertebrae, right, okay. Now you can see this superior articular facet, right, the superior articular facet, and this is the inferior articular facet, right, okay. And in inferior articular facet, you can see the inferior articular facet contain what the one facet, right, okay. And this facet, right, this facet articulate with the superior articular facet. So inferior articular facet articulate with which facet? The superior articular facet, okay. And they form one joint, right. You can see the one joint, they form one joint, and this joint known as what? The zygophysial joint or apophysial joint or facet joint, right, whatever you call, right, okay. So this is what the zygophysial joint, right, okay. It is which type of joints? It is the synovial joint, right, okay, ठीक है ना. Now we come to the now we come to the joint, right, joint form between the vertebra, right, between the vertebra and the ribs, right, okay. You can see this is this joint, ठीक है ना. These joints are formed by the vertebra and the ribs, okay. You can see this is in the body, right, in the body you can find two demi facet, right, okay. You can see this is the upper demi facet. You can see this is the lower demi facet, right, okay, ठीक है ना. So upper demi facet and the lower demi facet of the corresponding ribs, right, upper demi facet and the lower demi facet together form the complete, right, complete facet, right, okay, ठीक है ना. Now you can see the head of the ribs will articulate with this facet, right, okay, and the tubercle of the ribs will articulate with the rib facet, right, rib facet which is present on the transverse process, right, okay, ठीक है ना. And this articulation, you can see the ribs and the ribs and the ribs and this ribs and the ribs and this articulating facet, right, and this articulation will form the joint that this is known as which type of joints? It is known as the costovertebral joint, right, okay. And the tubercle, right, and the tubercle of the ribs and the facet and the rib facet of the transverse process, right, they form which type of joint? They form the synovial joint, right, okay. And that joint known as what? The costotransverse joint, ठीक है ना. So one is the costovertebral joint, another one is what? The costovertebral joint, right. You can see this is the costotransverse joint and this is costovertebral joint, right, okay. And both are plain synovial joint, right, okay. And they are the type of which type of joint? They are the gliding, right, gliding type of joint, right, okay, ठीक है ना. So this is the plain synovial joint, ठीक है ना, okay. Now this is also synovial joint, this is synovial joint, right, okay, ठीक है ना. Now we come to the joint between the two vertebrae, okay. This is the you know in between these two there is what? Intervertebral disc, right, okay. And then they form which type of joint? They form the secondary cartilaginous joint, right, okay. So total 11 joints are formed by the one thoracic vertebrae, right, okay, ठीक है ना. And also you know the sternum, right, okay. So this is the manubrium, right, okay. And this is the body, right, and this is the G5 process, right, okay, ठीक है ना. And you know the articulation, right, okay. Now the ribs, right, head head articulated with the thoracic vertebrae, okay, and you can say, and it articulated with this here, right, okay, you can see, and this is also the synovial joint, right, okay, and so which type of synovial joint, you know, the plain synovial joint, right, okay, is all the ribs which all the ribs articulating with this body of the sternum, they form which type of joint, the plain synovial joint, right, okay. Now thanks for watching this video.